A novel, do-it-yourself antifogging device for VITREO-RETINA surgeries. The wide-angle viewing system using the non-contact biome lens has become popular among VR surgeons. One of the drawbacks of this system is the intraoperative fogging of the biome lens. This usually occurs due to the condensation of the patient's hot exhaled air escaping through the eye drape near the medial canthus. This decreases the clarity and hence the efficiency during surgery. There are a few devices published in literature. et al. Suggested the use of a urinary catheter connected to the wall suction outlet. It may be a challenge to reconstruct the suction outlet in a relatively smaller setup. et al. Made a device which can be mounted on the 128 diopter lens of the ReSight system. The device may not be universal and hence need to be customized for individual biome design. We describe a do-it-yourself antifogging device based on filtered airflow. We will now demonstrate the assembly of our device. The requirements of this device are as follows. First, a simple aquarium air pump is taken. To its outlet, a small segment of a phaco-tubing set is attached. Now, an adapter is attached to the end of the phaco-tubing set. We then take two gas filters of 0.2 micron and attach them one after the other to the adapter. To the other end of the second gas filter, a sterile vitrectomy infusion tubing is connected. Here we have used the infusion tubing from the DORC vitrectomy set. Depending on the type of the infusion tubing set, an additional phaco-tubing segment and adapter can be used. Once done, the other end of the infusion tube can be fixed to the surgical field using sterile autoclave stickers. It is attached as such that it is directed towards the biome lens to prevent drying of the cornea. We will now further demonstrate the use of our device during intraoperative procedures. Towards the left, we have attached the sterile end of the vitrectomy tube to the nasal bridge of the patient with sterile stickers. The tubing is attached as such that it is directed towards the biome lens and not the cornea. Once the device is switched on, there is a gradual and consistent defogging of the biome lens as shown. To validate the safety of our device, we have cultured the filtered air from the device on Savarot's dextrose agar plates against a control of the OT air. As shown, both the plates have much lesser than 20 colonies at the end of 48 hours. This rules out the possibility of infection with the device. To conclude, our do-it-yourself antifogging device is safe, easy to assemble and cost-effective for VITREO-RETINA surgeries.